Things that silently damage your kidneys. Your kidneys are quiet workers. They clean about 150 to 180 liters of blood every day. They remove waste. They balance salt and water. They help control blood pressure. They even help make red blood cells. But the scary part is this: kidney damage can happen slowly. You may not feel pain. You may not see clear signs. Many people only find out when the damage is already serious. Once you go past stage 3 of kidney disease, there is no easy way to go back. This is a physically and psychologically demanding event where fatigue increases during the session. Rapidly removing large amounts of fluid causes dehydration and drop in blood pressure, causing severe exhaustion, cramps, and dizziness. The process removes essential minerals, amino acids, and nutrients, leaving patients feeling drained. Anemia and kidney failure. Chronic kidney disease means reduced red blood cell production, leading to persistent fatigue. Psychological load. Trusted health groups like the World Health Organization and the National Kidney Foundation say chronic kidney disease affects about 10% of adults worldwide. That is about 1 in 10 people. Many do not know they have it. Today, let us talk about 10 things that silently damage your kidneys. Number 1. Dehydration. Your kidneys need enough water to work well. Water helps flush out waste through urine. When you do not drink enough water, waste products become more concentrated. This puts stress on the kidneys. Especially if you are in a hot climate, make sure to drink enough water during the daytime. Research shows that people who drink very little fluid have a higher risk of kidney stones and kidney injury. In hot climates, or during heavy sweating, the risk is even higher. But drinking too much water all at once is not helpful either. The key is steady hydration through the day. Pale yellow urine is usually a good sign that you are hydrated. Number 2. High blood sugar. High blood sugar is one of the biggest causes of kidney damage. Over time, extra sugar in the blood damages the tiny filters inside the kidneys. According to the International Diabetes Federation, more than 500 million adults worldwide live with diabetes. About 30 to 40% of people with diabetes may develop kidney disease. Blood sugar goes high especially 2 to 3 hours after meals, so check your after-meal blood sugar to make sure that it is less than 160, as in the US system, or 9 in the British-Australian system. But here is the important part. Good blood sugar control lowers the risk a lot. Research shows that keeping HbA1c close to target can reduce kidney complications by around 35 to 50%. If you have had diabetes for many years, regular urine and blood tests are very important. Early detection works in your favor. Number 3. High blood pressure. High blood pressure and kidney disease are closely linked. High pressure inside the blood vessels damages the small vessels in the kidneys. The Centers for Disease Control and Prevention says nearly 1 in 2 adults in the United States has high blood pressure. Many do not know it. But uncontrolled blood pressure is the second leading cause of kidney failure after diabetes. Research shows that lowering systolic blood pressure by just 10 millimeters of mercury can reduce the risk of kidney disease progression by about 20%. Keeping your blood pressure around 120 to 130 over 80, if your doctor advises, can protect your kidneys long term. The 2025 American Heart Association, AHA, and American College of Cardiology, ACC, guidelines establish a primary treatment goal of less than 130 systolic and less than 80 diastolic for most adults to reduce cardiovascular risk. But lower, individualized targets, less than 120 systolic, to prevent dementia and improve long-term outcomes. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to me, encouraged to make more videos. Also tell me in your comments where you are watching from, which city, which town. Number 4. Smoking. Smoking harms nearly every organ. Your kidneys are no exception. Cigarette smoke reduces blood flow to the kidneys. It also increases blood pressure and heart disease risk. Research shows smokers have about 1.5 to 2 times higher risk of chronic kidney disease compared to non-smokers. But quitting smoking improves circulation. Over time, kidney function decline slows down. It is never too late to stop. Number 5. Processed foods and obesity. Processed foods are often high in salt, sugar, unhealthy fats, and additives. They increase blood pressure, obesity, and blood sugar. Many packaged foods contain hidden sodium. Some people eat more than 3,400 milligrams of sodium a day. The recommended limit for many adults is around 2,000 milligrams or less, especially if you have kidney problems. But reducing processed food intake can lower blood pressure within weeks. Research shows cutting salt can reduce systolic blood pressure by 5 to 6 millimeters of mercury on average. Fresh fruits, vegetables, whole grains, and home-cooked meals are better choices. Number 6. High protein intake, especially animal protein. Protein is important for muscle and health. But very high protein intake can put extra pressure on the kidneys. When you eat protein, your kidneys must filter more waste products. This increases the workload. Research shows that people with existing kidney disease who eat very high protein diets may experience faster decline in kidney function. Animal protein, such as red meat and processed meat, may increase risk more than plant protein. But this does not mean you must avoid protein completely. Moderate intake works best, especially if you already have kidney problems. Number 7. Lack of sleep. Sleep is not just for rest. It helps regulate blood pressure and blood sugar. Adults who sleep less than 6 hours per night have a higher risk of high blood pressure and diabetes. Both of these damage kidneys. Research suggests poor sleep is linked to faster kidney function decline. Shift workers may be at higher risk. But improving sleep habits can help balance hormones and blood pressure. Aim for 7 to 8 hours of good quality sleep. Number 8. Too much exercise. Exercise is good. It lowers blood pressure. It improves blood sugar. It supports heart health. But extreme exercise without proper hydration can cause muscle breakdown. This can release substances into the blood that harm the kidneys. A condition called rhabdomyolysis can occur in rare cases after very intense workouts. This can lead to sudden kidney injury. But this usually happens with extreme effort, heat, or dehydration. Moderate, regular exercise works best. Around 150 minutes of moderate activity per week is widely recommended. Number 9. Too much salt. Salt and kidneys are closely connected. High salt intake increases blood pressure. It also makes the kidneys work harder to balance sodium levels. Research shows reducing salt intake lowers protein loss in urine. Protein in urine is an early sign of kidney damage. Many people consume nearly double the recommended salt limit. But simple changes help. Avoid adding extra salt at the table. Check labels. Choose low-sodium options when possible. Number 10. Overusing painkillers. NSAIDs. Regular use of over-the-counter painkillers, ibuprofen, naproxen, aspirin, can reduce blood flow to the kidneys. Paracetamol, acetaminophen, is generally considered safe for the kidneys when taken at recommended short-term dosages and is often preferred over NSAIDs for individuals with existing kidney disease. However, long-term, high-dose, or excessive consumption can increase the risk of chronic renal failure. Number 11. Commonly used supplements with potential risks. Turmeric, curcumin, can cause kidney stone formation due to high oxalate levels. Creatine can cause renal stress, especially if combined with dehydration. Vitamin C. High doses can cause kidney stones and tubular damage. Ginkgo, echinacea, St. John's. Wort. These may interfere with medication metabolism. Number 12. Excessive alcohol. Drinking too much alcohol raises blood pressure. It can also cause dehydration. Heavy drinking is linked to increased risk of kidney disease. Research shows that chronic heavy alcohol use increases risk of high blood pressure by up to 70%. But moderate drinking, or avoiding alcohol altogether, lowers strain on your kidneys. Your kidneys are strong. They can adapt. They can recover from mild stress. But long-term exposure to these 10 factors slowly damages them. The damage builds quietly over years. If you already have diabetes or high blood pressure, your risk is higher. That is why regular blood tests for creatinine and urine tests for protein are important. Early kidney disease often has no symptoms, but later stages may cause swelling in legs, tiredness, nausea, and changes in urination. The good news is this: many of these risks are under your control. Drink enough water. Keep blood sugar within target. Control blood pressure. Stop smoking. Reduce processed foods. Eat moderate most plant protein. Sleep well. Exercise in balance. Limit salt. Avoid heavy alcohol use. Small daily habits work over time. Kidney failure is serious. It may require dialysis or transplant. But prevention works better than treatment. Research from large global health organizations consistently shows that lifestyle changes can reduce kidney disease risk by 30 to 50% in high-risk people. That is a powerful number. Your kidneys do not complain loudly. They do not shout for help early, but they depend on your daily choices. Take care of them quietly. They will work for you quietly for many years. If you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos. Thanks.